Few joys in life are more precious than having a baby. But couples today are faced with a number of decisions when it comes to bringing a new life into the world. The decision regarding when to start a family is many times at the top of the list, as more and more women contemplate career versus conception.
Women are being expected and they feel that they should contribute to the family finances these days. They want to pursue their careers. They're no longer willing to just sit home and raise children. And that puts a burden on their physiological demands for childbearing in future.
But can women wait too long to get pregnant? What are the ramifications of waiting too long? What is the ideal age to get pregnant? These and other questions are important ones for couples interested in starting a family to consider.
Absolutely, a woman can wait too long to become pregnant. She was born with 1 to 2 million eggs. By the time she came to the age of puberty, she would be left with about 500 to 600,000. By the time she gets to age 35 to 40, she's left with 25,000. And that's what we mean by the biological clock beginning to tick. You cannot set that clock backwards to fit your desires. First, there is infertility, which we define as a couple having difficulty achieving pregnancy after a year of unprotected intercourse. Then you add to that the fact that her pool of eggs are now down to about 25,000. The rate of degeneration of these eggs is increased, and chromosome problems that lead to miscarriages are increased. That's what we mean by age-related infertility. The primary cause of age-related infertility is a depletion of the egg pool. Then there are other problems like fibroids and endometriosis and polyps that get worse as the woman gets older. Chromosomal problems and miscarriages and difficulty in planting are all intertwined with this age-related infertility. Fibroids are actually benign tumors that grow out of spindle-shaped cells we call fibroblasts. They are the cells that unite tissue like after you've had surgery, and they also cause scar tissue in the body. If they grow on the skin, we call them keloids. If they grow, those benign tumors, on the uterus, we call them uterine fibroids. I think physicians should discuss age-related infertility with patients, along with discussing pap smears, weight loss, exercise, good dieting. Most of the time, I run into patients who have never had this kind of conversation with their physicians. And they wonder why nobody ever brought it up in the past. And I think it's incumbent on us to bring it up along with other healthcare issues. Age-related infertility can best be prevented by avoiding it in the first place through education. When they come for their yearly exams, especially in their mid-20s, we should ask them during the process of counseling for contraception, for instance, are you intending to be a mother? And if so, we need to let them know that their supply of eggs once they reach 35 and above is limited. Obviously, there is the cryo technique, which they can use to save eggs, but those are very expensive and insurances don't cover them. Yes, there is a screening for age-related infertility. You can do what we call the clomiphene citrate stimulation test, or you can measure the 3-FSH or estradiol and inhibin. And lately we have the anti-Mullerian hormone, which tells us how many primordial follicles are left in the ovaries. The options depend on if there is adequate ovarian reserve. And if that's the case, then she can go directly to IVF. If there is not much response, then she can borrow eggs using the egg donation program, or she can actually go for surrogacy, in which somebody will donate the egg and practically carry the pregnancy for her. And finally, there is always the borrowing of embryos, embryo donation.
Patients who are in their early to mid-30s or beyond who are considering pregnancy or have been trying for any length of time without success should be screened for age-related infertility. To learn more or for an evaluation, contact the office of Dr. Emmanuel Mba today.